So multi-parametric prostate MRI uses different types of MR imaging sequences or acquisitions to investigate tissue. So for prostate, we would use three different types of acquisitions. One would be what we call a T2 weighted image, which assesses the water content of tissue. Then we'll do something called a diffusion weighted sequence, which assesses the cell density of tissue. And then we'll do a contrast enhanced image, which assesses the vascularity of tissue. And by integrating those three different components, we're able to come up with a likelihood or unlikelihood of whether or not tissue is tumor or not. We, in general, don't use the endorectal prostate probe anymore. So that's added to patient comfort. Basically requires that the patient lie in the magnet for about 40 minutes or so. At the end of the exam, they get an injection of a small amount of intravenous contrast, and then they're done. So it's about a 40-minute exam or so. I think that it's becoming standard of care to recommend multiparametric prostate MRI in the appropriate settings. We're able to identify cancers that often get missed otherwise. And then the next step after that is, once we identify them, we're able to actually guide the urologist to target those specific areas to biopsy them correctly. It greatly increases accuracy and ultimately improves patient care. So it really is a great benefit to the patient and to the urologist. A CAT scan just does not have the contrast resolution that allows for detection of small cancers and assessment of potentially higher grade cancers. Likewise, ultrasound really doesn't have the resolution to assess for higher grade cancers and for staging. So MRI provides that. The evaluation of the prostate doesn't end with the MRI reading. There's lots more that happens after that. So if we find a cancer on MRI that needs to be biopsied, what we can do is we can actually highlight that area on MRI. And then there are facilities that have MRI ultrasound fusion biopsy systems. So we can take the MRI images and fuse those with the ultrasound images real time while the patient's on the ultrasound guided biopsy table, so that the urologist can then target that lesion in time and in space and have a much greater accuracy of targeting the lesion. So that provides a much higher yield for identifying clinically significant cancers. So that provides a significant added value to the patient and to the urologist. I would strongly encourage that urologists integrate utilization of multiparametric MRI in their evaluation of patients who potentially may have prostate cancer.